Okay.
Ready?
Okay. Mhm.
Greetings. I am your host, Chris Payne, and I am the editor of MS Focus. I'm delighted to introduce our speaker today, Dr. Ben Thrower, who will be presenting updates on MS and cannabis. Dr. Thrower is the medical director of the Andrew C. Carlos MS Institute at the Shepherd Center. He previously served as the medical director of the Holy Family MS Center in Spokane, Washington. Dr. Thrower is the Senior Medical Advisor for MS Focus, the Multiple Sclerosis Foundation, and he enjoys contributing to our quarterly MS Focus magazine. We are pleased to have him join us this afternoon. Dr. Thrower, thank you for being with us, and now I'll turn this over to you.
Thank you very much, Chris, and thank you to everyone else at MS Focus working tirelessly to bring education and awareness on multiple different MS topics. And thank you to everyone who's joining us. The topic of cannabis and cannabinoids and MS always seems to generate a lot of interest, and hopefully we'll be able to provide some information, hopefully answer some questions. I am continuously learning more and more about cannabis and multiple sclerosis. I'm certainly not an absolute expert, but I feel like I have learned quite a bit over the years. I'm going to try to give some updates and some challenges that we see in the world of cannabis and MS. So the cannabis plant itself has been with humanity for many, many years. We can go back at least 10,000 years and identify cannabis products being cultivated and used in humanity. Most of the origins of cannabis and cultivation seem to go back to China, but then you can kind of follow its spread, through the Roman empires, through the Persian Empire, and really start to see it picked up for use, not only for things like rope and paper, but medicinal uses, especially by the Greeks as they started sort of modernizing medications and medicines. Phytochemistry, what is so when we think about the cannabis plant, it is incredibly complex. So there are over 480 active ingredients, chemical compounds in the cannabis plant. About 66 of these would be what we call cannabinoids. And we're going to spend a little more time talking about the kind of where these might fit into the world of multiple sclerosis. Another chemical compound that we find in cannabis would be the terpenes. Terpenes are aromatic oils, and they're not unique to cannabis. If you ever look at the leaf of the cannabis plant, you'll see these sort of shiny little dewdrops of liquid. Those are the terpenes. We also find terpenes in things like orange peel. When you smell an orange peel, those are terpenes that you're smelling. Pine cones, so those are terpenes that you're smelling. So they're present through a lot of different types of plants. We're going to focus really on two major cannabinoids. Again, there are 66 plus in cannabis, but we're going to really focus primarily on THC and CBD. One of the major distinctions between THC and CBD is THC would be a psychoactive cannabinoid, whereas CBD tends to be non-psychoactive. Cannabinoids can be found obviously in the plant itself, in the cannabis plant. But one of the questions that was raised, early on is, if these cannabinoids that we have in a plant, if they're doing something in the human body, there must be receptors in the human body for these cannabinoids. And if there are receptors in the human body, wouldn't that mean that we are making endogenous or endocannabinoids? And that's absolutely true. So endocannabinoids are those cannabinoids that we make in our body itself. And the two that we'll look at are anandamide and 2-AG. And then we have synthetic cannabinoids. An example of that would be a molecule called dronabinol, which is a synthetic THC with the brand name of Marinol. So there are a lot of different ways that one might get cannabis into the body. Certainly smoked or vaporized, sublingual oils, topical oils, ointments, creams, or eaten as some form of food or candy. These are all the ways that one might get cannabis into the body. So there's been a little confusion over the years between the different cannabis species. So all of these are cannabis. There is cannabis sativa, which traditionally we've thought of as being a higher THC, lower CBD ratio plant. There is indica, which is a higher CBD, lower THC plant. And then there's hemp. Technically, hemp is a subspecies of sativa. Over thousands of years, hemp was bred to have a thicker stalk and less kind of leafy appearance. And in breeding that thicker stalk, what they were trying to do is make rope and paper precursors. In the process of sort of creating hemp, plant breeders inadvertently actually largely bred the genes out of hemp to make THC. So typically when we think of hemp, we think of a cannabis subspecies that has less than 0.3% THC. So we mentioned some of the uses of hemp, but it's really a widespread product, ranging from textiles, rope, paper, fuel, foods, animal put into animal feeds, animal bedding, mulch, just many uses outside of normally what we think of as CBD production. And we're going to come back to that thought of hemp-based CBD. So hemp-based CBD products, these are products that really are not supposed to have more than 0.3% THC by dry weight. They're available everywhere. I mean, if you Google CBD store near me, you'll pull up lots of different options. They can be oral, vaped, topical, but hold on to this thought of hemp-based CBD products, because this is where things have gotten really weird out there recently, and where I think we need to spend some time talking about some of the newer hemp-based CBD product or hemp-based products. So shifting now to kind of more of an MS focus. So what does science say about cannabinoids and multiple sclerosis? What are some of the potential side effects from cannabinoids? And then I won't be able to talk about global law, but just some things about US law in particular as it relates to cannabis. We will touch on that. So from a science standpoint, we need to step back and talk about this endocannabinoid system. So the endocannabinoid system is composed of cannabinoid receptors, the endogenous cannabinoids that our body makes, and the ability then to break those down. And the endocannabinoid system has a lot of different functions. It seems to play a role in metabolism, weight maintenance, inflammation, cognition, mood, and pain. So there are two endogenous cannabinoids that our body makes. One is anandamide. This was the first endogenous cannabinoid discovered. The word was anandamide was derived from an ancient Sanskrit word for bliss. And then there is the 2-arachidonoglycerol, or 2-AG. So these are the things that our body makes that are going to work at those endogenous cannabinoid receptors. And there are two types of cannabinoid receptors in the human body. There's CB1. CB1 is primarily present in our brain and spinal cord, and it seems to be inhibitory. So when you think about our brain and the synapses in our brain making neurotransmitters, typically you have a sort of neuron producing a neurotransmitter that's going to go across a little space called a cleft. It's going to influence then the next neuron and tell it to do something through that neurotransmitter. The endocannabinoids are produced on this downstream, if you see my arrow, on this downstream side of things. and then they bind back upstream to this CB1 receptor, and they help shut off any further production of that neurotransmitter. So CB1 receptors and the endocannabinoids that bind on them are mainly inhibitory. They kind of shut down this neurotransmitter production. So if this is a neurotransmitter that plays a role, say, in pain production, this may be why we see an anti-pain effect. If this neurotransmitter is increasing muscle tone, this may be why we see an sort of an anti-spasticity or anti-spasm effect with these endocannabinoids and the CB1 receptors. CB2 receptors are primarily present on cells in our immune system. And this is where we think some of the anti-inflammatory effects of endocannabinoids and exogenous cannabinoids come from. Almost every immune cell in the human body expresses a CB2 receptor. So it really speaks to the large role they may play in the immune system. So I picked this review paper. It's about 6 years old now, but it was a review paper from JAMA, the Journal of the American Medical Association, and it pulled together multiple other studies looking in general at where cannabis might be used as a therapy in multiple sclerosis. And it looked at a fairly large number of people, over 3,000 individuals with MS. And their conclusion is that there was data suggesting some effectiveness for cannabinoids in the treatment of spasticity, pain, and bladder issues in multiple sclerosis. Their conclusion was that overall the safety of the cannabinoids was good. So we mentioned that the CB2 receptors in the endocannabinoid system are present on cells in the immune system. So again, it speaks to this anti-inflammatory effect. These CB1 receptors in the brain and spinal cord, because of that sort of inhibitory loop, might suggest that there could be some neuroprotective effect. So it's kind of tantalizing to think, could cannabinoids be a disease modifying therapy? Could they actually, act like some of our traditional disease modifying therapies and, lessen the rate of relapses or new lesions on MRI or slow progression of disability? While it's an interesting theory, no study has shown that yet. So I think for right now, until science tells us otherwise, I would think of the cannabinoids as a symptom management, more so than a disease modifying therapy. So what are the symptoms that we could see that the cannabinoids help with? Spasticity and spasms. We realize those really are two different things. You may have both of them, but spasticity is more the chronic state of muscle tightness. So for instance, if I have spasticity in my arm, maybe my fingers, wrist, and elbow are held in a more flexed position. I have spasticity or flexor spasticity in my arm. If it's in the leg, maybe it's extensor spasticity. Whereas a spasm is that wave of muscle tightness that comes on, like a Charlie horse, sort of, it's more of an episodic. Now you may deal with both of those things, but technically they're different. One of the reasons that distinction may be important is that most of the data would suggest that cannabinoids are probably more effective for managing the spasms than they are for the spasticity. When we do studies on spasticity and spasms in multiple sclerosis or spinal cord injury or stroke, a lot of time we use this thing here called the Ashworth scale. The Ashworth scale is really a measure of spasticity, not spasms. And the reason it's important to kind of know about this is the cannabinoids, when they've been looked at for managing spasms and spasticity, they really don't seem to work on the Ashworth scale. So we don't think that this is probably a good thing to use when we're doing clinical trials of cannabinoids in multiple sclerosis. Doing spasm count. So, when a person just keeps a diary and says, before I started treatment X, I had this many spasms per day, and now I'm on the treatment. Now I'm having this many spasms per day. The synthetic THC derivatives, that dronabinol or marinol that I mentioned, don't appear to be quite as effective as the real deal cannabinoids, the plant-based cannabinoids. Central neuropathic pain, so this is burning, hypersensitivity, maybe electric shock type sensations that we can see in multiple sclerosis. Both the natural and the synthetic cannabinoids do appear to decrease central neuropathic pain for multiple sclerosis. And then lastly, we can think about using cannabis to measure, to help treat and manage an overactive bladder. So if you're having a lot of urinary urgency and frequency, there is some data out there suggesting that those may decrease with cannabis. Anytime we think about treating, anything really in medicine, we need to think about the risks, the benefits. What are the good things? What are the potential side effects? And so when we think about cannabis, it's certainly not free of all side effects. We can have altered senses. Sometimes people will see brighter colors. There may be this altered sense of time. This altered sense of time, people really need to be aware of if they're using cannabis and thinking about driving or operating heavy equipment. Changes in mood. Typically we think of cannabis as causing people to feel kind of mellow or a little bit high, but there are people who actually have paranoid reactions with cannabis. Slowing or impairments of body movement, alterations in thinking, impaired memory. Higher doses can result in hallucinations or delusions. There was an interesting study in 2019 that spoke some to the potential cognitive side effects of cannabis. They looked at 40 individuals with MS who were using cannabis, and this was in a smoked form about 4 times per week. All of them got baseline cognitive testing. And then what they did is had half of the group continue to use their cannabis as they had before. The other half stopped it. They repeated the cognitive testing 28 days later. And the individuals who had stopped did show some improvement on cognitive measures. And this is not to say that that you shouldn't use cannabis, but just like anything else we do in medicine, we need to know the risks and the benefits. I can tell you in fairness, if I put someone on more traditional therapies for spasms in multiple sclerosis, things like baclofen and tizanidine, those drugs can have cognitive side effects as well. So all of these therapeutic endeavors do have risks and benefits. This is one that people should be aware of. It's cannabinoid hyperemesis syndrome. Again, normally we think of cannabis as lowering nausea and vomiting. The synthetic drug that we mentioned earlier, dronabinol or marinol, is used a lot of times in chemotherapy patients to treat nausea and vomiting. Ironically, in some people, you can actually get the exact opposite. This is usually seen with an acute, very high dose. So someone getting way more cannabis in whatever form, usually it's going to be smoked, inhaled form, than they would be used to, or they're chronically using very high amounts. These people will present to the emergency room with intractable nausea and vomiting. People who have experienced this will say that if they take a warm shower, something about that warm water seems to have a temporary calming effect. The treatment for this is unfortunately just waiting it out, hydrating the person. A lot of our usual medicines that we use for nausea, your Phenergan, Zofran type medicines, don't seem to work very well for this. So it's more just supportive care and waiting it out. One of the things that we really encourage the MS community to do is if you're going to use cannabinoids in whatever form you're going to use them, treat them just like you would a medication. You want to know the risks, the benefits. If you come into your healthcare provider and you say, I'm using, a THC gummy, it's really helpful if we know the milligrams. Let us know the milligrams of THC and or CBD that you're taking. Giving us a brand name really doesn't help very much. And be aware there could be potential drug interactions, just like we see with prescription drugs. These cannabinoids are metabolized in the body. And sometimes when molecules are competing for metabolism in the human body, they can change the levels of one versus the other. So what about the cannabis and the law? And again, this is just going to be a brief overview. Um, there is just in April of this year, the DEA did vote to move cannabis from a Schedule 1 to Schedule 3. Schedule 1 is things like cocaine, methamphetamine, heroin. So you're really bad actors, things that have high addictive potential. Usually Schedule 1 drugs are said to have no medical purpose whatsoever. And for years we've said, well, that's not true with cannabis. We do think that there's potential medical use, and we don't see, certainly not the addictive potential that you would see with some of the other things that are in Schedule 1. So in April, the DEA did vote to move it from Schedule 1 to Schedule 3. One of the really important things about this move is it will really open up medical research for cannabis. The White House still needs to sign off on this, which we expect that they will. Just to give you an example of how difficult things were. So we were doing research with what we were hoping was going to be an FDA approved version of cannabis called Sativex. We'll talk a little bit more about this later, but for us at our center to do a study with Sativex, we had to get a special waiver from the DEA, which was interesting and a long process. And not only get that waiver from the DEA, we then had to get a special research pharmacy designation from the state of Georgia, which was almost as difficult as what we went through with the DEA. Very long process, months and months and months to get that designation. This rescheduling of cannabis from Schedule 1 to Schedule 3, I think will eliminate a lot of that and it'll really open up research. So this is just a map of the various state laws in the United States regarding medicinal cannabis use. And as you see, it's a patchwork. I mean, the states are all over the map. It would be nice if there was some sort of uniform law. And one of the challenges is that if you're in, say, a medical cannabis card registry in one state, very, very unlikely that that's going to be able to transfer to another state. You know, we have a law here in Georgia, but you know, our Georgia card holders can't go into, say, Florida and access a dispensary there. So it really is very individual by state. I throw this up there because this one is going to have some implications for some of these new hemp-based CBD or hemp-based products that we see out there. So how is it that we are allowed to buy CBD in all the CBD stores that are around the nation? It was based upon this Industrial Farm Bill Act, which allowed for farmers to grow hemp and to produce these CBD products with no more than 0.3% THC. It gets reauthorized every 5 years. It is due for reauthorization this year, and we would assume that it will get reauthorized. So up until recently, if we said, well, what are legal hemp-based products? We were talking about the CBD products, and they were legal in all 50 states. We felt like there was really no potential to get high from them because they had 0.3% THC, very, very minimal amount. So we thought of these as things that might help with sleep, and maybe some anti-inflammatory effects. They do seem to have a little bit of a calming effect for people with anxiety, and that these stores were popping up everywhere. So the prices were really coming down. And then things got kind of weird. So now when you go into a CBD store or you go on social media, you're going to see Delta 8, Delta 9, and Delta 10 THC products being sold everywhere. How are these being sold if THC is so regulated? It's because these products, in theory, started life as hemp. And remember that Industrial Farm Hemp Bill Act said, well, we can grow hemp, and that's so that we can legally produce CBD. So what the hemp growers have done is they have figured out a way to chemically convert CBD into the isomers of Delta 9 THC. So it could be Delta 8, Delta 9, or Delta 10 THC. So these really are not true plant-based THC products. These are products that have been sort of manufactured in a lab, starting with CBD. Um, this is driving the DEA and a lot of states nuts, because it really is a very sort of roundabout way of getting really very potent THC products out there, widely available. One of the biggest concerns I think that we have from a healthcare standpoint is the manufacturing process. The manufacturing process frequently uses things like toluene, formaldehyde, hydrochloric acid in the manufacturing process. And we would like to think that these manufacturers are getting those things out of that product before it hits the shelf. But there have been some chemical studies that have said that that may not always be true. So these are just some examples of THC products, and these are, the THC in these products, you started life in theory as CBD, and that's how they're sort of able to do this legally. So there are high THC gummies out there. There are all kinds of these sort of soft drinks now, tonic waters that are flavored that have THC in them. So this company Delta, actually, I saw this pop up on Facebook, and so I did a little research into it. It's legit. I mean, this is no joke THC. This is the Delta Light, because this has 5 milligrams of THC in it. The regular Delta has 20 milligrams of THC. If you were to be someone who's not very experienced with THC products and you drank that can with 20 milligrams of THC in it, you're going to have a very interesting next 24 hours. For someone that is, relatively novel to cannabinoids, probably is going to get away with the 5 milligrams. One of the concerns is this looks fun, and so we can have kids picking these things up, not really realizing what it is, and knocking back a can of this stuff. These are just some of the other THC products that are out there. So I think this does kind of sum it up. There is a lot of irresponsible production going on out there, and so really just be aware that these things are out there. I would say if you're going to use one of these hemp-based THC products, look for this. Look for a certificate of analysis. There are reputable manufacturers will put their products through these independent laboratories. And what these labs do is they break down all of the different cannabinoids, and they tell you how many milligrams, is what they say is in the product actually in the product. What some of these analyses will also do is they'll look for contaminants, things like heavy metals, or some of the byproducts of maybe that conversion process from CBD into a THC product. So if you can find this with any of these products you're looking at, that would be ideal. So some of the FDA approved products, so these are synthetic cannabinoids. So there are two of them. There's Marinol and then Sesamet. These are both synthetic THC in a capsule form. The Marinol or Dronabinol is approved for nausea in chemotherapy, and this one is approved for nausea and also for neuropathic pain. Be aware, these are pure THC analogs. There's no CBD in this. It is felt sometimes that when you start adding CBD to THC products, you may blunt some of the psychological effects and get more of the anti-pain or anti-nausea, the therapeutic effect that you're looking for, with less high effect. I mentioned this one just because it is an FDA approved cannabinoid. So this is Epidiolex. This is GW Pharmaceuticals out of the UK. This is CBD, and it's a high dose of CBD. It is FDA approved for certain types of pediatric epilepsy. This is the one that we were studying and other MS centers were studying. So Sativex is a roughly one-to-one mixture of CBD to THC. It's manufactured by GW Pharmaceuticals in the UK, and they have indoor growing operations. So what they're doing is taking one cannabis plant that is very, very high in THC, isolating the THC from that plant. They're taking another plant that's very high in CBD, isolating the CBD from that plant, and then blending those together into this little sublingual spray. It's approved in multiple countries around the globe for use in spasm management and multiple sclerosis. Unfortunately, the studies in the US were halted. I suspect that there were a lot of reasons, part of which may have been a business decision that, I think as this company looked at where potential increasing legalization, both medically and recreationally, was moving forward in the US, maybe they were perceiving that their market for this might have been less. We were excited, and I think a lot of people in the MS community were excited about this because of several reasons. It would be a very high quality, very laboratory tested product, and insurance should have covered it because it would have been FDA approved for spasm management. One of the mistakes I think that GW made in doing their trials is in one of their studies, they picked that Ashworth scale that we mentioned. Again, no cannabis product has ever been shown to change that Ashworth scale in multiple sclerosis, and yet these guys picked it and it didn't change it. Other studies have shown that it does decrease spasm count and quality of life as reported by people with MS. So again, a little frustrating for us here in the US that it doesn't look like we're going to get this FDA approved. And I'll just mention for our local folks, Georgia's CBD oil law. So in the state of Georgia, we do have a THC registry. One of our champions was Dr. Representative Alan Peak out of Macon. He was working with a lot of Georgia families with children with epilepsy, and these families were traveling all over the U.S. to get cannabis products for their kids with epilepsy, and he thought that just wasn't right. So they passed a law allowing for 5% THC oral products in the state of Georgia. It's interesting when the law was first passed in 2015. So we had a lot of card holders with different health conditions, including MS. So they've got a card saying they can have this 5% THC oil, and there was nowhere to buy it in the state of Georgia. We do now have, I'm sorry, these are the medical conditions that are allowed. We do now have dispensaries open. So the Georgia legislature awarded 6 licenses to different cannabis growers. These are indoor growing operations. The growers are allowed to also operate dispensaries. And so 2 of these companies, Trulieve and Botanical Sciences, are up and running. There may be more now, but eventually we'll have 6 around the state of Georgia that are open to anyone with one of these medical THC cards. And again, everything in the state of Georgia is oral, no inhaled products are sold through these dispensaries. So before we open it up to sort of question and discussion, just in summary, hope you see that cannabis is a really complicated plant with many biologically active components in the form of cannabinoids and these terpenes. Some of these components may be useful for managing certain symptoms in MS. Again, if you're going to look at cannabis and cannabinoids as for symptom management in your MS, treat it just like you would any medication. Look at the risks and benefits, know where it came from, just apply that same sort of thought that you would with any other therapy in MS. I wish our laws in the US were a little more uniform. We are really a confusing patchwork of different state and federal laws. And again, here recently with these hemp-based THC products, they're just widely available. It really has become the wild, wild west out there, making things even more confusing and just one more indication that you need to be a smart healthcare consumer. Know what it is that you're putting into your body, know where it came from, look for that certificate of analysis. And with that, I am going to throw it back to Chris.
Thank you. And now we're ready for some questions. And we've got a lot of them. Just a reminder, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you are on the phone. I will call on you, and then you will be able to unmute to ask your question. And with that, we're going to open it up. And our first question is coming from Cheryl. Cheryl, can you hear us? Cheryl?
Yes, sorry.
Hi
You
there.
have a question.
I don't know. I didn't submit a question. I'm sorry.
Well, good talking to you anyway.
You
Sorry about that. And by sorry, I mean I accidentally muted Cheryl, accidentally cut her off. Didn't mean to do that. But we'll go ahead and move on to another question. This one coming from Elizabeth. When starting medical marijuana, how does a person wean off their baclofen?
That's a great question. So my preference is to make one change at a time. And again, I'm not saying that my way is the right way. This is just how I do things. I suspect if you go around the country, you may see different healthcare providers doing things different ways. But what I would recommend people do is not change their baclofen or tizanidine dose. Start with a very low dose of cannabis. You know, to me, it's a little easier to work with oral forms because I can look at a gummy and say, okay, that has 5 milligrams of THC and so many milligrams of CBD. If it's an oil, I can show the person in a dropper, this is what it has. It's a little harder to do that with inhaled forms, and we really don't know in a given inhale how much you're getting. But that's not to say you can't do that. It's just a little harder medically to know what dose you're getting. So, what I typically just have people start with a low dose of oral THC, maybe 2.5 to 5 milligrams, see how you tolerate that. And then if we seem to be getting control of whatever symptom we're going after, whether it's, for instance, with baclofen, it's spasms, then we're going to start maybe slowly dropping down on the baclofen dose. We're not in any hurry to do this. One of the things I would recommend, if you try an oral cannabis product, whether it's a gummy or an oil, and you let's say you try 2.5 to 5 milligrams and you see nothing with it, don't take any more that day. Where people get into trouble is they'll take a gummy and 40 minutes later they say, I don't feel anything, I'm going to take another one, and then the next thing you know, they're laid out on the couch high as a kite. So again, we're not in a race. I would tell you, if you try a cannabinoid, a gummy one day and you don't see an effect, the next day maybe try going up on the dose of it. And so again, we'll do this very slowly.
All right, our next question comes from Jim. He asks, Doc, your thoughts on how fast the medical research will ramp up once cannabis is rescheduled to a Schedule 3?
I think it will probably be fairly quick. I think it's what's interesting to me is, I mean, when you look at a lot of big pharma companies, they have some interest in this in terms of looking at how cannabis might be used for different symptoms, not only in MS but across other health conditions. Obviously, the cannabis industry, the growers have interest in this, and there's an awful lot of money in this industry. And so I do think that there will be more of that money going towards research at this point.
Our next question comes from Sandy. Sandy, can you hear us? Sandy?
Can you hear me?
Yes, we can.
Okay, I have a good question. Because I've been experimenting with the smoking marijuana for over 20 years, and certain strains do certain things. And I'm wanting to know if you know what strains do different things. Because I have one strain that helps my bladder, another strain helps my leg, where I can move it better. And I don't take any shots. I did that 20 years ago and got worse, and quit every medicine. I've been off medicine for 15 years. I don't take anything.
So really, and that you're right, that is a great question. So really, with the different strains, what you're really looking at is the different ratios of largely THC and CBD. There may be other cannabinoids. Again, there's 66 of them in the plant, and it could be that the ratios of those may play a role. I think we've only scratched the surface of what the terpenes are doing. That said, I don't think we've gotten smart enough to get it to the level that you're asking. So, which product is going to work best for spasms versus bladder symptoms versus neuropathic pain? I think it's going to really be a lot of trial and error, with different products. I think, if you're using smoked, plant material, I mean, as much as you can keep it within the same, so if you know where you're getting it, it'd be nice if you say, okay, this guy has this hybrid or this plant, and I will, I know that this version is what, helps with this symptom. Some of the more sophisticated growers can have certificates of analysis for their different plants, so that'd be nice if that was available. Obviously, it's not for everybody, for every grower out there, but I mean, if you could get it to that level, you really could say, okay, I took this, and here's the certificate of analysis, and here's what's in that. This is what works for this symptom. It'd be nice if we could get it to that level.
Right. I wish they'd ask me, because I have so many things that, like, this does this does that. If I could get them all together, it would be great.
Absolutely. And the challenge is, and this is true with your traditional prescription drugs, what you're going to see is what works for you, what your magic bullet is, may be very different from someone else's. And a dose that you tolerate might be ineffective for someone else, or might cause, unacceptable side effects for another person. And that's not a knock on cannabis. I mean, we certainly see that with baclofen and tizanidine, and, really in any therapeutic endeavor.
Right. And sativa is the only one that I can use. If I use the other one, all my symptoms get worse. So
So most people find that the sativa, products where it's higher THC to CBD ratio, people talk about that as being more of a kind of a body sensation. It tends to be less sedating in general, whereas the indicas, people were usually looking at those for more bedtime use because of the higher CBD to THC ratio. I think where it's gotten very challenging is because there's so many hybrid plants out there now. I don't know that distinction between sativa and indica always applies directly. I would really like to know, can you show me what's actually in the plant? What the milligrams and ratios are of those cannabinoids.
Thank you very much for participating, Sandy. We really
thank
appreciate it.
you.
Yeah.
Our next question comes to us anonymously. The question is, why, when I have a gummy 0.75 milligrams, I get off balance? Why is this? Is it too much, or should I not use it?
So it's interesting. So there was a VA study years ago where they looked at cannabis use in some of the veterans dealing with spasms and spasticity in MS. And there was a group of individuals who said, yeah, my spasms got a lot better, but my walking got worse. And what they were probably referring to is being off balance. Balance is tricky in MS, and there are a lot of things that can affect balance in MS. So, it may be that you're, affecting, some of the things in the vestibular system or proprioception that allow you to have good balance. Again, if the bad for you individually outweighs the good, it may be that this is just not a great route to go for you.
All right. Just a reminder, if you have a question or comment, you can ask it using the Q&A button in the app, which also allows you to send your question anonymously if you so choose. Or you can ask your question live by raising your hand. To do so, click the raise hand button or press *9 if you are on the phone. I will call on you, and then you will be able to unmute and ask your question. And our next question comes from, it's cutting off the name. What I have is Samia. The question is, Doc, I'm an occupational therapist with multiple sclerosis. I was wondering if there's a chance I am able to take CBD products with a medical card and still practice in Florida.
So you're going to want to look at what your state laws are. So you can find CBD products that are zero THC. So, for instance, the MS center that we're at, we have a CBD gummy that is zero THC. So that would be one option, is just to get a zero THC product. So most of the CBD gummies that you're going to see out there, again, putting these newer high THC products aside, so most of your traditional CBD gummies are going to have 0.3% THC. Most people are not going to have a positive drug test with that, and it's not going to have any cognitive side effects for you. So from a practice standpoint, I wouldn't have any concern about someone taking CBD and practicing medicine. Again, it's the amount of THC is so low, it's not going to have any practical effect. What you do need to know, though, is what your state laws are and what your individual, if you're working in a hospital or in a therapy, this private practice, you want to know what those are. Some systems have a zero tolerance policy. They say, we don't care whether you're impaired or not. If you test positive on a random test for THC, there are going to be implications. Others, for instance, what we see here in Georgia is facilities would say the only reason we would test you is if you have an incident, there's something happens that will lead us to question your ability to practice. So that would be the only reason you would get tested. And then if you tested positive for THC, that could be a problem. So again, I think you have to really look at what your employer's policies are, and then just know there are zero THC products out there.
All right, our next question comes from Jeanette. Jeanette, can you hear us?
I can. Yeah, I can. So I mean, I have a lot of urinary, and just like Sandy said, I would love to find what would be the balance. I do get a lot of paranoia when I was younger and I smoked. I have 2 young kids, so I don't want to have smoking in my house to show that it's okay to do it since they're young. And I'm only in my 40s. And versus like going to Nevada where you can just walk in and get it, it kind of costs a lot here. And so my thing is I can get trospium, or I just had bladder Botox that actually did the opposite. I mean, it costed me $100, and trospium costs me like $4. Versus if I go get gummies, they're gonna cost me around $20. Even versus like Clonopin or Valium, I only paid $2. So I mean, how does it weigh? Because I have noticed I have taken gummies in the past, and it hits me a little bit faster than if Valium or Clonopin would. But I really struggle with the urinary right now, and that's more like my concern, is I really would wish to find something that would help with that. I have spasticity and I have some other stuff and cognitive, but more or less I really don't want to go. I hate taking medication. And I definitely, my doctor said the next thing would be like the implant, and I don't want to do that.
So I would definitely make sure it sounds like you are working with the urologist if they're mentioning things like the intrastem or the Axionics implants. The other thing that is just non-cannabis related, but just is kind of newer on the scene with bladder management, are some of these posterior tibial nerve stimulation units. So these are sort of hooked up to the lower leg. You go in for sessions with the urologist, spend 30 minutes. Usually it goes on over several weeks. And what you're trying to do is retrain the bladder. And then the hope is that retraining lasts you for months, and maybe then you redo that training. So it might let people avoid those surgically implanted devices like the InterStim and Axionics. The good news with the InterStim and Axionics is there is a trial before you have to commit to it. Obviously, that's a big deal to have something surgically implanted. I generally, again, I think I mentioned before, I find it easier as a medical provider working with orals versus smoked, just because I think it's a little more controlled. One of the pharmacokinetic challenges with inhaled cannabis is you get these really high concentrations in the CNS, but then they tend to drop more quickly. So it may not last as long as an oral form. We'd like to avoid the paranoia. It's obviously very uncomfortable for a lot of people to have that sensation. I think I tend to see a little bit less of that with the oral formulations. You hit on a great point though with the cost. I mean, that has been a major rate limiting factor for a lot of people with MS using cannabis is it can get pricey. Even just strip plain old CBD without THC, which can help with sleep. We tend to see that a month supply, usually, $45, $50, $60, depending upon where you're getting it. So I wish I had an answer on the cost into things. I know some of here, like in Georgia, some of our medical dispensaries do have financial assistance plans and discounts for people with different, in different settings. So it certainly is worth asking about it and seeing if there's any kind of financial.
Yeah, I do have one down the street, so it's worth. My friend goes all the time. I do with the ratio, like you said, 1 to 1. I've gone to one dispensary and got gummies and I was fine, but then I went to another one and got the same ratio and it gave me that like paranoia. So it's just different.
I would look at if they've got those COAs or certificate of analysis, just so that you're holding them accountable, that is what they say is in that gummy really in that gummy. Yeah.
Okay. Thank you.
Thank you very much, Jeanette. We really appreciate you participating. Our next question comes from Mike. He asked, can you talk briefly about RSO products?
So RSO, or Rick Simpson's oil, has been around quite a bit. So this is a high THC product. It's certainly, I mean, for some people, it can definitely help. You just need to know, if you're a novice to cannabinoids, you want to get some dosing guidelines. Again, it is a potent high THC product. Again, certainly be of use for managing spasms or neuropathic pain or bladder symptoms, but you're definitely going to want to sort of ease yourself into it if you're a novice to cannabinoids. But yeah, certainly no reservations about people trying that.
Our next question comes from Maria. What do you recommend for MS fatigue? Any certain strain or product? Nothing to smoke or vape though, please.
Yeah, I wouldn't say that fatigue is usually the typical symptom I would think about managing with cannabinoids. Now that said, we do hear people say with the higher THC, lower CBD, more the sativa end of things, that they do find it activating. I wouldn't say that that's been the first thing I would think of for managing fatigue. With fatigue, that's a whole topic in of itself. We want to look at sleep issues and medication side effects. And if at the end of the day, we really think it's primary MS fatigue, do we look at prescription medications, whether it's, modafinil, stimulants, amantadine? There's some limited data for some more natural substances for fatigue management. There was interesting small study looking at oral lavender capsules in the daytime for managing fatigue. Kind of ironic because we normally think of lavender as something you take at bedtime for sleep, but some people did see benefit with 600 milligrams of oral lavender. There have been some older studies with acetylcarnitine, again, over-the-counter supplement, for managing fatigue. So lots of options. I wouldn't say it's impossible that there's somebody out there that gets an activating boost from a cannabis product, but it wouldn't be my first go-to for managing fatigue.
Our last question comes from Pamela. Is there a source that tells us what to look for in a product and how much for which symptoms? Or is it all still trial and error and guesswork?
A lot of trial and error. I wish I could say otherwise. I mean, there are a lot of resources online out there. There are different groups that they'll look at medical cannabis for a lot of different health conditions. They're going to give you guidelines on on different types of products. You can get education on the endocannabinoid system, like we've talked about here. But once you're armed with that information and you've decided I'm going to try this product, that's where the trial and error comes in, because I can tell you in a large group of individuals with MS what the trend will be for managing a certain symptom. But when it comes down to you as an individual, I think that's where the trial and error comes in.
And with that, we come to the end of this teleconference. If you missed any part of this event, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for more information. By participating in a short survey sent to you after this webinar, you will be able to help us learn the type of information most meaningful and helpful to you as the attendees of this conference. If you'd like to support programs such as these, consider donating at msfocus.org/donate. Be sure that you check out our supporter savings program where you can save more than you give. Be with us next time when our teleconference will be at 4 p.m. Eastern on June 24th, when Herb Karpakin will host Ask the Physical Therapist. Once again, our thanks to Dr. Thrower and all of our attendees.